Okay, these are some of the most common shoulder and arm strengthening exercises that we do here. So what we'll do is we'll put a towel under the affected arm on the elbow. This just helps keep the arm and shoulder and everything in the correct position for the exercise. Okay, this is shoulder internal rotation. You make sure that you have the towel here under the affected arm, and then you just bring the arm in like this, 3 sets of 15. A lot of times on the chart it will say safe position, and that just means that we don't want them to go past here, like that. We want them to start here and go in like this to avoid injury. This is shoulder external rotation. You have the towel under the affected arm, under the elbow here, and then you start with the arm towards the stomach and bring it out away. And you do 3 sets of 15 with this one. And you also, if you see safe position, we don't want them to go past here when they're pulling it out. We don't want them to do that. A common mistake when doing internal rotation and external rotation for the shoulder is to move the elbow and arm around a lot. So this, putting the towel here, helps them keep the arm in the correct position while they're doing the exercise. This is shoulder extension. You take the bands in each hand and you pull down to the side like this. You do 3 sets of 15. And if it says safe position, we don't want the patients to go past this part right here, like that. This is horizontal rows. You start with your arms extended with the bands in each hand, and you pull back like this, bending your elbow at about a 90-degree angle. If it's in safe position, you don't want them to go past their back like this, and you do 3 sets of 15.
So this is sideline external rotation. So you can lay down, you can give them a pillow. They're going to have their arm at a 90-degree angle. Often they start without a weight, but if they do have a weight, it'll be written on the chart. They're just going to be lifting that arm up like this. If it says safe position, you don't want them to go farther than this. You don't want them going up like this, and it's going to be 3 sets of 15. All right, so this is full cans. They're going to start standing with the weights in their hand, and they're going to be coming up like this. The arms aren't going to be straight out or straight forward. It's going to be kind of right in the middle of those two, just coming up and then going back down in a nice controlled movement. This is going to be 3 sets of 15. You want to make sure that their thumbs are facing up like they're holding a can of soda. And if it says safe position, you don't want them going higher than right here. So none of this. So this is shoulder taps. So you're going to come over here, or you can also do this against a wall or another staple service. And they're going to kind of put their feet a little bit farther back and be leaning like this. They're going to have their arms on here for support, and they're going to alternate touching their shoulders like this. This is going to be 3 sets of 15. Shoulder taps get harder the lower you go, so if the therapist asks you to progress it and the patient feels ready, then you can come somewhere to like a bench or to the floor. So it's just going to be a little bit lower, but the same thing, 3 sets of 15, touching your shoulders.
All right, this is cane ER stretch. So you want their arm to be out at about a 90-degree angle, and then you're going to push the hand down with the cane. And it's important to line the cane up with your opposite hip from the arm you're stretching. That way it's moving in the right direction. A common mistake is they'll push it this way or really any way other than what they're supposed to do. So just keep an eye on them, and you'll hold it for about 10 seconds, 10 times. All right, this is the sleeper stretch. You'll have the patient lay down on the affected side, and you can put a pillow under their head for comfort. You'll put the affected arm at 90 degrees and you push it down towards the table until they feel a stretch, and they'll hold it for 10 seconds, 10 times. A common mistake is they won't have the arm high enough up here, or they'll push it other directions. Just keep an eye on them and make sure they're pushing it the right way at 90 degrees. All right, these are table slides. You'll have the patient put They're both hands on the pillow when they're doing table sides flexion, and they'll push it forward until they feel the stretch and hold it for 10 seconds. And they'll do this 10 times. A lot of times it's helpful to put a timer for 3 minutes and have them just do 10 seconds and then take a break until the timer goes off. For table slides abduction, you'll just put the one affected arm on the table, and same thing, you'll slide until you feel the stretch and hold it for 10 seconds, 10 times. If a patient is doing table slides and they feel like they're not getting much of a stretch, you can make it a little bit harder by either scooting the chair back so they have to go deeper, or you can get one of the wedges off the table and put it down so that they're kind of sliding up the wedge. All right, these are the pulleys. There are 3 different directions that we do. We do flexion, scaption, and abduction. With all of these, you want the affected arm to kind of be limp and not resisting the pull of the other arm, and you'll hold it for 10 seconds, 10 times. Common mistakes with the pulleys is that they won't have their arm out and limp. They'll kind of lift up by themselves without letting the other arm do the work. And then they'll also go really fast. We want to make sure it's nice and controlled and that they're holding it to get a good stretch, because this is helping with their range of motion. All right, this is a really common one. It's called scap sets. And what we have the patient do is we just have them pull their arms back and squeeze their scaps together. And we kind of will tell them to pretend they're squeezing a walnut or something between their shoulder blades. And they'll just hold it for 10 seconds, 10 times. A common mistake with scap sets is that instead of pulling back, they'll just kind of bring their shoulders up. This is shoulder external rotation. You have the elbow under the, did I say the elbow? Sorry.